You are listening to The Scope, Phelps Health Podcast, Episode 7. Today we're discussing COVID-19 updates. Let's get started. Hi everybody, I'm your host, Paige Heitman. The Scope Podcast is produced on a regular basis and can be found by visiting phelpshealth.org. Come back often and feel free to add the podcast to your SoundCloud stream or subscribe to our YouTube channel. You can also follow us on Phelps Health Twitter, Instagram, LinkedIn, or Facebook. All links are in the show notes. Now let's get into the show. Today our guest is Ed Clayton, President and CEO of Phelps Health. Today we're going to be discussing COVID-19 updates. So, Ed, welcome back to our show.
Well, thank you for having me.
We're really excited to have you here. So, Phelps Health began reopening not that long ago. So, as we began reopening all of these services, how has Phelps Health adapted to this next normal or this new normal, whatever we're kind of calling it, with check-in procedures, appointments, and surgeries?
Sure. So, and those are all three very different services that we provide, and the way that our processes work. So, in terms of individuals that are coming to our clinics, we have processes in place that when they enter our buildings, they now go through a wellness screening, which includes taking their temperature. It includes asking them questions about their respiratory conditions. For those individuals that are coming to clinics where we have, where once they get past that checkpoint, they would go up an elevator, we now have restrictions on the number of people that can be on the elevator. So in the past, you might have seen a lot of people just behind where those checkpoints are today. Now we're much more socially distanced, very few people on those elevators. And then when you come into the clinic and you see the receptionist there, our goal is to move our patients back to the room where the physician or nurse practitioner is going to see them as soon as possible. So trying to avoid waiting in the waiting rooms in our facility. So really trying to strictly adhere to the social distancing, making sure that we have space between individuals that might be in there, and then finally just making sure that we are, and we've always been this way, but just making sure that we are disinfecting and cleaning as much as we possibly can.
And I've also heard that appointments are kind of being spaced out too in the hospital, so that if I have an appointment at 9 o'clock, I'm not going to run into a lot of other people that also have the same appointment at the same clinic at 9 o'clock, right?
Yeah, we're going through a tremendous amount of effort to, if we have a doctor that sees, let's say, 15 patients during the course of the day, they're not doing that all in a very compact time frame. We're trying to space that out through the entire day, just to limit, and this is no different than when we first started 2.5 months ago, limiting just unnecessary interactions with individuals as they move about in our facilities. In terms of our surgery department, a lot of similar type of precautions have gone into that as well. One of the things that we're doing in addition to that is for elective procedures, we are asking our patients to undergo testing for active COVID, just to ensure that they don't have that active disease process. The surgical process inherently potentially exposes our employees, and so that's one extra precaution in our surgery suites that for elective procedures where it's not time sensitive, we ask them to do that. And then for our ancillary services, particularly those in our medical office building, for many of them we have extended hours right now to try to catch up for some of the services that were postponed in the last 2.5 months, trying to catch some of those up. And so we have extended hours there as well.
So what do you anticipate the next steps for Phelps Health looks like as we continue to reopen our services? So
the biggest challenge for us is and that's not the biggest challenge, but one of the challenges for us is making sure that we have adequate supply or PPE and other supplies in order to care for our patients. And so as those supply channels become more, we become more confident in those, that allows us to continue to increase volume. As we become more confident of our processes and operating our clinics and moving patients through ancillary service areas, that allows us to increase the number of patients that we're able to see in those areas as well. So really it's about understanding our new normal, understanding the way that we need to operate in ensuring that we are protecting our patients and our employees. And as we become more comfortable and more aware of those processes, we could become better at them and be able to see more patients.
So that brings me to a really interesting question. If our community were to see a surge in the coming months, because all of these guidelines and restrictions are being lifted across the nation, especially in Missouri and in our county and jurisdiction, do you think that we're still prepared to handle a surge if we were to get one?
Yeah, so one of the key differences, in my mind, there's two key differences where we are today, maybe versus where Phelps Health was at 3 months ago. The first is our, I don't want to use the word stockpile of inventory, of PPE inventory, but that's pretty much what it is. We have much more inventory in place today than we had 3 months ago. And so were there to be a massive increase or some type of second surge, from a supply perspective, we're in much better shape than we were 3 months ago to handle something like that. And then the other thing, which we didn't talk a lot about it at early on, but was going on in the background, was surge planning. And we really, you can call it a game plan or a game book, but we identified, as we saw more and more patients, things we needed to do to care for those patients, all the way up to being able to see around 225 patients in our facility. And so that plan's now in place. We spent several weeks developing that plan back in March. We have it now, so if we were to see a surge, quite frankly, we pull that playbook off the shelf, we go to that surge level, and we operate the facility in that way. So we are in very good shape if there was something like that to happen.
So we're prepared for a post-pandemic future and whatever that might bring, including all of these new potential surges that may or may not come, as well as all these other unknowns. What are some new things that you think you guys have learned from COVID-19 that has helped the hospital?
Yeah, I think one of the things that we were forced to do as part of this was to begin to use telehealth services. And so, and that technology has been there for years, but this crisis sort of caused our government regulators to pull some of the restrictions off of it. And quite frankly, it's been such a huge success for us, and being able to see our patients, ones that may have some type of COVID risk or infectious risk that you'd like to keep out of the facilities, be able to provide another mechanism for them to see their physicians. And it's allowed that tool to kind of take off. And so we're actually actively developing what the next generation of that already looks like when we implement our new electronic medical record here in a few months. I mean, that to me, that's one of the big new developments that will change how we operate in the future. Just that having that service available.
What's the importance of a gradual reopening for Phelps Health? I know we talk about telehealth and how important that is, and what a great stream that's been for patients, because they may not be able to come to the hospital, but they can still see their provider. But we can't just open up right now and have all of our visitors come back in, but we have these screening stations. Why are all of these things important to have?
Well, we still know, although thankfully it's not nearly to the degree that we thought, but we still know, we still believe that there is potential for exposure in our community, and we want the hospital to be, and our clinics to be a safe haven, if you will. We want our patients and our employees to be able to come into our facilities, receive care, our employees to come in and to do their jobs and to provide that care, and for them to feel safe. And our marketing now is we're open, we're safe, and we're ready to serve our patients. And it's important for us to reopen in the right way so that we are able to do those things.
So we talk about we're open, safe, and we're ready to serve our patients. Whenever patients do come into the hospital, if they're unable or they don't want to do a telehealth visit, how can they protect themselves and help protect the people who are caring for them at Phelps Health? Sure,
so a few simple things that they can do. We do still, and for the foreseeable future, will require universal masking inside our facility for both our patients as well as our employees. I would encourage those patients to have masks to bring those and wear them into the facility. For those that don't, we have those available and they can receive those at the checkpoints. But certainly utilizing that mask throughout the entire time that they're in the facility is important. And then the second thing, and this seems like a little thing, but it's not, is arrive on time. We don't want you to be late, and we don't want you to be early. We don't want you to arrive on time, because when you arrive on time, we're able to move you through the process efficiently, move you into the actual room where you're going to have your visit with your physician, and prevent you from having to stay in waiting areas or things where there may be other unnecessary interactions with individuals. And so those are both simple things, but doing those things certainly provides additional protection for our patients as they seek services inside our facilities.
The arrive on time I know was really hard for me, because I've always been told if you get there early, then you've done well. If you get there on time, then you're late. And then if you're late, you're forgotten.
Right.
So I think we almost have to retrain ourselves to, if you get there on time, then they're going to be able to take care of you on time.
Right.
I even did it with my vet appointment with my dog earlier last week. I got there a little bit early and I had to wait in my vehicle, and they couldn't take care of me.
Yeah. And keep in mind, you mentioned earlier the fact that our patient appointment times are being spread out.
Yes.
And so that will also allow for an on-time arrival to move back more quickly than in the past, where if we had a number of patients that were scheduled close together, arriving on time may have put you behind. So again, I arrive on time and wear a mask. And then the third thing is just follow those social distancing provisions that we've talked about. I mentioned earlier if you're on the elevator, the 4 people on the elevators is what we have internally, and then just observe the social distancing if you happen to be in the waiting room for any length of time.
We also have stairs. If anybody's really fit and they feel like they really want to take the stairs, they're more than welcome to do that too.
They're right. There's multiple ways to get to the appointment.
So a lot of healthcare organizations were in the same boat as Phelps Health, and they moved mountains to get ready for this crisis very, very quickly. How is Phelps Health working to bring that same energy into the recovery process?
So here's what I would say. I'm very proud of this organization, not just for its response to COVID, and not just for its response to once we've kind of cleared the peak of it and we're starting to reopen services. We had that energy with everything all the time. What was different about COVID and reopening is that it was focused narrowly on one thing. If you went back 6 months ago, we've got a number of projects that were going on. A lot of folks that are working really hard to make our programs available and successful, and to take care of people in our service area. That goes on all the time. I think what was unique about COVID is we really centered and focused on one thing, as opposed to a number of things that we normally do.
And it's really cool to see how our organization can come together and take care of each other, our patients, and our community.
Yeah. And I will mention also, outside of our organization, it was really, for us, it was certainly recognized that our community came together as well, and helped in that process, helped us care for patients, helped us prepare for the potential surge of patients. And so that singular focus, while it was inside our organization, was also outside of it as well.
Absolutely. Do you see any of the process at Phelps Health changing long term due to COVID-19? I know that we've implemented telehealth and some other projects and things as well. Do you see any of those staying long term?
I absolutely see the telehealth. That's probably the number one thing I think will be when hopefully in the future we have a vaccine that rids us of COVID. The telehealth services are here to stay. In that, in terms of the foreseeable future, I think we're still going to have these checkpoints. Our patients and our employees are going to. That's just something that we're doing to protect each other, and it's really not that evasive in terms of our daily lives as it is experiencing those checkpoints. The masks, I think those are still going to be in place for a while. Nobody enjoys wearing them.
Everybody enjoys breathing.
Yeah, they're not fun to wear, but until we get to a point where we're comfortable that we're not putting the safety of those that in our facility, whether it's our patients, our employees, at risk, and that's one way to mitigate that risk. I think we'll continue to have that for a while, but I do look forward to the day where that restriction can be lifted.
Me as well. Yeah, I would like to go into the grocery store or to go wherever and to just be able to breathe freely.
Yes.
I know as soon as I get my vehicle, I rip it off.
Yep.
So something else that's been really, really unique to Phelps Health and a couple of other healthcare systems like Cox Health is that we've been able to avoid furloughs that other healthcare systems and hospitals unfortunately have had to implement during this crisis. Why is that?
Well, I don't want to speak for other healthcare systems because every organization and every industry has their own unique situation.
Of course.
For us, we've had a strong history here of making sure that we, just like your parents teach you, have a rainy day fund. And our organization, I've been here 18 years, almost 19 years. During that whole time, we've been building a rainy day fund for some crisis that no one really understood or knew what was going to happen, but we have some reserve for that. This was the situation. So we were able to first of all start off with that reserve in hand. Secondly, early on, we as the executive team of the organization as well as the board of trustees made the commitment to our employees, saying that that's our team, and we want to do everything in our power to make sure that we're taking care of that team. We really went out of our way to try to, for those employees that were displaced, that maybe worked in surgery before and now we weren't doing that number of surgeries, where else in the organization could we have them go, which would create benefit both for them and our patients. A lot of them ended up working the respiratory screening tent at that point. Other patients that were, or other employees that were displaced worked the screening stations. And so we were able to maneuver through that, and it's one of the things, and certainly we don't know what the future holds either. That's another thing I will say, but thus far we've been able to negotiate that, and it really comes from that, having that financial stability from the past, and then secondly, the commitment to our employees, that we want to do the right thing for our employees. And we also understand as one of the larger employers in the community, when large employers expand and do well, there's a spiraling upward effect for the community because there's more dollars generated in the community that get spent. The opposite is true too, unfortunately. And so we're very thankful that we were in the position that we were in, and to able to continue to keep our employees whole during the process.
Yeah, I think that's really great. I mean, I know I've been kept whole, and what's really cool is that our community has given to us, and I know I've been buying stuff from Red Door, I've been going to Alex's Pizza, I've been going to Slice of Pie, because we all need pie right now.
That's right.
to get through this. But I know we're kind of nearing the end of our show, and I want to give you an opportunity to share any final thoughts that you have on COVID-19, whether it's for our patients, our staff, or our community as a whole.
Well, I just, for our community, first of all, every week that goes by, we're busier and busier, both in our clinics, in our surgical suites, and in our imaging and diagnostic services. So it's safe to come back and receive services as an organization. This organization is doing everything in its power to make sure that when you enter our doors, we provided a safe environment for you. So you should feel comfortable in doing that. I want to thank our community. I mentioned earlier the generous donations during early on in the COVID process, and we had businesses, we had individuals, we had the university and the school system provide different levels of support to us, and those haven't gone unnoticed, and we certainly appreciate what our community's done for us. And then for our employees, I mean, every day they walk in, we take care of sick people, and we've been focused the last couple months on COVID, but our doctors, our nurses, and our clinicians take care of sick people every day, and they do things that are just quite remarkable, and I'm very proud of how they've come through this process and their commitment to the community and to the safety of all of us.
Thanks for tuning in to The Scope today. I'm your host, Paige Heitman. If you liked our show and want to know more, check out phelpshealth.org. Thanks so much.